Right. So for the next contraceptive type we should be looking at is what is known as the contraceptive implant. Contraceptive implant. So the implant is usually what they usually put is in the biceps. They usually put the implant in the biceps. All right. So what's the contraceptive implant and what is its application? So you should just know that this one is commonly goes by the brand name what Nexplanon. Right. So it's a flexible rod about the size of just a matchstick. So just like you have matchsticks, just the size of a matchsticks. All right. So it's really inserted under the skin of the upper arm. Now you might actually get to wonder why they are putting something in the upper arm here, and they are saying this thing can all the way stop fertilization. All right, by the time we are done you get to understand. So it's one of the most effective forms of long-acting reversible contraception. So they say reversible simply because if you put it there, anytime you remove it, the woman can actually get pregnant. So like when you actually put like one, it can protect for about 3 to 5 years, right, of pregnancy prevention. So how does it work? It releases a steady dose of progestin. It's a synthetic hormone. So the progestin, that hormone, will stop the woman from making eggs. So there will be no eggs for sperms to fertilize. You understand? So it usually also thickens the cervical mucus, making it harder for sperm to like reach an egg. So it also thins the uterine lining, reducing any chance, even if there's fertilization, implantation is impossible. So benefits is actually 99% effective, works for 3 to 5 years depending on the brand and the guidelines. There's low maintenance. So once you put it, that's all. There's no disturbance. Reversible. Once you remove it, fertilization comes back. So it's safe for people who can't use estrogen, can reduce heavy or painful periods. So possible side effects is you can have some irregular spotting or irregular bleeding here and there. That's usually for the 6 to 12 months. Headaches, mood changes, acne, then breast tenderness, right? So I think that was it. So insertion and removal is usually done in a clinic with local anesthesia, because you have to like put it under your skin, so they can basically numb that place so that you don't feel pain. So it takes just a few minutes. Removal is also quick and can be done anytime. Okay, so you are protected immediately if inserted within the first 5 days of your period. So that's for the contraceptive implants, usually called Nexplanon